Well, if you look at healthcare around the country and the way in which it's provided and who it's provided to, you can, I'm sure, see that most hospitals and clinics are in urban areas. In fact, if you look at some of the numbers, I understand only around 5% of people living in rural areas have medical aid. Ruth Lewin is the head of sustainability at Discovery. Ruth, good afternoon to you. You've been looking at this. What kind of picture are we seeing in rural areas? I would imagine in many places it's actually very difficult to get health care.
Definitely, Stephen. In our engagement with our many rural stakeholders, we understand that rural communities face many barriers to accessing healthcare, which include transport to healthcare facilities, limited healthcare facilities, financial barriers, inadequate infrastructure in healthcare facilities, limited services, and huge workforce deficits. And all of these entrench the many inequities which already exist.
How bad is it? I mean, are there particular problems? I mean, I would imagine there might be chronic conditions that are almost impossible to treat, or let me put it another way, almost impossible to get treatment for.
Yeah, so, we've kind of focused a lot more on what our mandate is able to do. So, if you look at just the statistics, South Africa has about 8 doctors for every 10,000 people, less than half the global average. But the shortages are much more concentrated in the public sector than in the private health care, and even worse in rural areas. And so we've got kind of 3 areas that we focus on. One being community health. The second is human resources for health, and that's a big focus of both the Discovery Fund and the Discovery Foundation. And the third area is reducing maternal, infant, and child mortality.
Are there places or examples where there are solutions that actually work, where we've seen an improvement?
Absolutely. We are very excited by a couple of partnerships that we've had over many years, one of which is over 20 years. That is the Umthombo Development Foundation in deep rural northern KwaZulu-Natal, where in the late 90s, a medical officer at a hospital called the Mossveld Hospital found that he just had huge difficulty in attracting medical doctors in particular into this very beautiful setting, which is near to the Mozambican border. And he eventually resolved that one way of addressing this challenge that he had was to recruit local youth in grade 10 already from the high schools there. And these are like very indigent communities. And where these young people showed an interest to work in the hospital, they were exposed from grade 10 to come and work during the holidays. And Dr. Andrew Ross, who's now a professional an academic at the University of KwaZulu-Natal, expose these young kids and help them to get into tertiary institutions. And the successes have been phenomenal. So whilst they were wanting to only address the particular challenge at the Mossveld Hospital, they have to date, since 1999, they've managed to assist 524 graduates through the Umthombo Youth Development Foundation. All of these graduates have studied in 18 health science disciplines. 55% of them are women graduates. And the success rate has been phenomenal. It's premised particularly on a kind of mentorship program which assists these young people in psychosocial and academic mentorship once a month at each institution. They have had a 92% year-on-year progression rate. They've been able to get their students to complete their studies in the minimum time plus 1 year. And 80% of these graduates have remained in the public sector, with many still working in rural settings. And just to add one last comment on this, beyond the Mossveld Hospital, they have managed to capacitate 18 participating hospitals in rural KwaZulu-Natal and in the Eastern Cape. And we've just been very fortunate to partner with them. Over the past 20 years, the Discovery Fund has invested a total of 15 million rand in Umthombo's scholarship program.
So, I mean, we talk about private-public partnerships sometimes. Are there other examples of those that work? I mean, is this a model that we can look at for the rural sector?
Absolutely. Another really great example for us is the Hlokomela Primary Healthcare Facility in Hoedspruit. They provide primary healthcare services to farm workers in the greater Hoedspruit area, and they've had significant results in bringing down progressing the health profiles of their patients, where they started out with a between 27 and 29% HIV infection rate in the early 2000s, and they're now down to about between 7 and 9%. With very simple methods of providing health care, and they've been able to start to open up a women's health facility, which when I visited there a couple of years ago, finding this wonderful facility that can detect breast lumps, etc., they presented a challenge to me and said, we are unable to do a referral for these women to a tertiary institution. And so I was reminded at the time of another partnership that we had with, or still have, in fact, with the Breast Health Foundation under the leadership of Professor Carol Ben at the Helen Joseph Hospital. And we were immediately able to fund 12 women to go to Helen Joseph for treatment. And it was a huge success. However, what we found in the process, with information provided to us by the Breast Health Foundation, was that the model wasn't a very viable one. Here you had a situation where women were traveling thousands of kilometers, or hundreds of kilometers, I should say, 6 hours on a taxi between Hoedspruit and Johannesburg. They would receive all kinds of treatment, including chemotherapy, and have to travel feeling really ill on a 6-hour journey back home. And as a result of this information, we thought, we have to find a better solution for women in the area there. And so that resulted in further funding to the Breast Health Foundation to engage a whole host of stakeholders in Limpopo and in Mpumalanga, sure, and to see how we could bring these, sort of breast cancer services into the area.
Ruth,
and
I'm afraid we'll have to leave it there. Thank you very much indeed. Ruth Lewin is the Head of Sustainability at Discovery. Do appreciate it.